You know, the holidays are right around the corner, and we'll all be dressing up, wanting to look our best. Well, are you happy with your derriere? Well, we're going to help you become happy because we're calling on our coastal expert at Renewal MD, Dr. Joel Shanklin. Hi, Dr. Shanklin. It's great to see you.
Hi, Natalie. How are you?
So today we're talking about making sure that our butts are in order during the holiday season. So are there procedures that we can do? Because I know that there are three types of butt lifts. The
Correct.
Traditional butt lift, the butt implants, and the Brazilian butt lift. What are the differences in those three?
Well, traditional butt lift is essentially a incision across the upper buttock, hip, where we're taking out some excess skin to truly lift it. For a patient that may say, it sags, but I don't want a really big butt, and I just want it lifted. They may have lost weight, or in some women, if they've been runners all their life, that kind of tends to happen as they reach a certain age, and some of the fat just starts to essentially go away. So just a lift, straightforward surgical procedure, outpatient procedure, takes about 2 hours where they're asleep doing it. Recovery is really just avoiding a lot of vigorous activities and allowing it to heal over 10 to 14 days.
And it is outpatient.
Yes.
Wow.
It's outpatient. Next, getting into buttock implants, really not done anymore. Over the past 10 to 15 years, partly based on the fact that a lot of those implants created complications in patients. Nowadays, I mean, for me, it's been 8-10 years before I've put one in, or since I've put one in. In my entire career of almost 20 years, I've now taken out more implants than I've put in terms of the buttock. It's just not really done in the US anymore. Well, the trend entirely is fat grafting, buttock augmentation, or they may come in with a ubiquitous term that you used, Brazilian butt lift, which is not really lifting with creating an incision and scar. It's lifting by augmenting the buttock with fat to expand it out. And as you expand it out, you're going to lift it up.
Most patients walk in with a picture of what they want their derriere to look like?
Some do, and it's helpful to make sure that that patient and I are on the exact same page of what they want. Some will then come back with a picture saying, well, yeah, this is what I want to do. Or if I just use those terms, do you want the Kardashian, do you want the bubble, or do you want, the more athletic or Serena Williams buttock, that very athletic but projects out posteriorly without as much width compared to like the bubble.
With the Brazilian butt lift, you also get the benefit of liposuction.
Correct.
So can you choose the area for lipo?
You can, but I always tell patients, because we are doing the buttock, I've got to remove the fat that may be camouflaging the buttock around it. And usually that's the lower flank, the area right above the buttock, that some people term just their hips. And it may go all the way up to the armpit on each side, where I want to sculpt that, because I also want to create somewhat of that hourglass appearance coming down to whether we're giving more projection posteriorly or projection posteriorly and laterally in the hip to give them more of that hourglass. But I want the area above the widening of the hourglass to also be narrow. So it's always going to be the back, the flank, going all the way up the armpit. If they want to do their stomach at the same time, sure, we can do that as well. In majority of patients, I only need the fat from each side of that kind of flank back going up to the back of the armpit as enough volume for each buttock.
How does it stay put, and will it? Is it permanent?
It is permanent. It's your own tissue. And with the harvesting techniques that we use and the devices that specifically we use in the practice, we can get a much higher success rate of the grafting using the type of liposuction system that we use within this practice.
I would think, we sit on our butts, of course, every day.
Correct.
This is a part of the body that we use on a daily basis. So can you sit or can you not sit for a while? Explain how this recovery process works.
The procedure and how we do it, I'll keep the patients overnight in our facility for observation. They go home the next day. They can essentially lay flat in bed, either on their back or on their side. What I tell them not to do is recline to where they're putting a lot of pressure on the buttock. And the important thing with sitting, and it's like I always tell the patients in our consult, it's like when you were in your grade school classroom and the teacher would tell you to sit up straight. It's that when you're sitting, and I'll show you here on the chair, you have to sit and almost lean forward. So, and I tell patients, sit and lean forward with your hands. Don't sit with a chair that has a backing, because when you look at this, and if you put your finger right on the point that you're sitting and you stand up, you realize you were sitting on the area that's really the crease of your buttock.
Right.
So where we actually do the procedure and that I augment is more of the upper 2/3 of the buttock. I'm not putting fat down on that area that you sat on. But if as soon as you lean back in that chair or recline in your bed, you're squishing what I put in.
A lot of viewers out there are watching right now, and of course, holidays right around the corner. This is something that they can get done before the holidays and
absolutely.
look incredible in those red carpet looks when they're walking into the holiday parties.
Absolutely. The recovery is, in most patients, it may be 10 days out of work, but they'll wear a compression garment for a total of 4 weeks, but most of them that third and fourth week, they're back doing most everything.
It's so great to see you, Dr.
Thank
Shanklin.
you very much,
Thanks so
Natalie.
much for all the information you always provide. It's great to see you.
You too.
If you'd like more information on Renewal MD or any of our coastal experts, just check out our coastal experts page. You'll find that at wsav.com.